Okay. Good evening, ladies and gentlemen. Welcome to the City of West Miami Planning and Zoning Board meeting of October 22nd, 2019. Members present are Alvaro Lorido, Diana Rio,
Yes.
members Gilberto Gonzalez, Eugenio Gonzalez are, well, we're waiting for them. Also present is Mr. Juan Pena, Planning and Zoning Director, and Jose Villalobos, City Attorney. It is 7:40 p.m. for the record. Mr. Pena, if we can take things a little out of order and begin with item number 3. Or the minutes.
That will testify will repeat after me, please. Raise your hand. I do solemnly swear to tell the truth, the whole truth, and nothing but the truth.
I do. First order of business under the agenda is the old business, the approval of the minutes from the meeting of 7/23/2019.
Okay, unfortunately, we're going to have to defer since Mr. Laredo was excused that meeting. Maybe we should defer. Or can we vote the remaining 2 members?
No.
Defer?
I move to refer to the next meeting.
So we'll defer this item. Do we need a roll call?
No. Agenda item number 3, property address 1659 Southwest 67th Avenue, Chick Beauty Salon and Spa. Applicant is requesting a sign permit for an internally illuminated sign for the front elevation of the business as provided in the attached exhibit. Zoning ordinance 282, section 22. That's the last item that you have in your paperwork there. As you can see, this is a small business on Southwest 67th Avenue. The size of the sign is 3 feet by 8 feet, which is 24 square feet of the 56 that's allowed on the property. It's an internally illuminated brand new sign mounted on the facade of the building.
Okay. Right, any comments from the board?
Yeah, I have a comment. Well, the sign is the actual letters where it says Chic Beauty Salon and Spa I think they're very pleasant to me. The fact that it's a box sign deters from the direction that we want to go to in the city as far as signage. I would recommend individual letters attached to the existing parapet.
Okay.
Internally illuminated or backlit letters with no channel shown on the facade.
Is this a new, is the box itself existing or new?
All new.
All new, okay. We would like to see that. I'm trying to see how they can incorporate like the logo and the website. Mr. Laredo, any comments?
Yeah, I mean, as we can see in the drawing, we have, on the picture, we have some spotlights or floodlights actually showing the sign, and those will be gone.
The overhead light is the spotlights will if you make it, yes, they will remove the spotlights. There's no purpose for the spotlights if they go with
That's
the
right, yeah.
internally illuminated.
And just out of curiosity, it has nothing to do with this particular case, but what's the sign next to it? That's a temporary sign that's visible in the picture, the business, the adjacent business?
That's something that's under code enforcement.
That's under what?
Code enforcement.
Okay, sorry. Thank you. I'm gonna have to say that we've been trying to be consistent with the box signs, I'm sorry, the letters, individual letters. and maybe they can come up with a way to do it and incorporate the website or place it on a window sign or something.
Right, the phone number
And-
and the website.
And
for-
go with the individual letters, and unless required for security reasons, those floodlights, if they can be removed or replaced with something more modern, more aesthetically pleasing. And that being said, I would make a motion to that.
Make a motion to deny the sign as it is,
And instead,
and instead provide individual letters for the name of the establishment, and then the salon and spa, the phone number, and the Instagram, I think, Instagram, or whatever, they want to put website or whatever, to go on the door or in another place, maybe on the door.
okay,
No raceway on the letters, or no visible raceway from the exterior, and to remove the 2 spotlights.
okay, I had made a motion, so I'm gonna amend it and say the motion with Mrs. Rio's comments as well.
And I will second that.
Okay, on the motion, Alvaro Lorito,
Yes.
Diana Rio,
Yes.
and I vote yes with the comments.
Okay. Next item is under new business, public hearing agenda item number 1, property address 6400 Southwest 8th Street, special use permit number 2019-002, Gilberto and Teresa Uribe / Banyan Community Health Center, Inc., 3910 West Flagler, Miami, Florida, 33134. Applicant is requesting a special use permit for the property located at 6400 Southwest 8th Street, West Miami, Florida, 33144. The property totals 149 feet, .11 feet wide by 266.3 feet long, and and the existing building has 7,500 square feet. The applicant is requesting a special use permit to operate a community medical health center. The applicant will renovate the existing building to accommodate medical offices, examination rooms, dental offices, treatment rooms, ethical pharmacy on premise. The total acreage for this C parcel is .4445 acres, and the total lot coverage acreage of the R5 off-street parking for commercial is .6255, for a total combined of 1.0701 acres. Section, zoning ordinance, section 282, section 2A, 4.31.
Okay, thank you for reading that, Mr. Penn. I was hoping to take item number 2, but since you read that, we'll go ahead and proceed with item number 1 then.
Okay?
So, okay, go right ahead.
Name and address for the record, sir.
Good evening. Rick Morgan, 13104 Southwest 107th Court, Miami, Florida. Good evening. Again, my name is Rick Morgan. I am the General Counsel and Chief Risk Manager with Banyan Health. With me is Bruce Hayden, the President of Banyan Health, and Mark Guthrie, the CFO, pardon me. At 6400 Southwest 8th Street, Banyan proposes, upon the approval of this committee, to establish a federally qualified health center. It's already been acknowledged and approved by the Department of Health and Human Services, and that is, because I anticipate some concern, it is primary care. And it brings to the city of West Miami additional care for children, for women, for the elderly, all in the context of primary care. And that's what the intent is. Now, there are, we also looked, and there seems to be a need for dentistry in West Miami. and that has been approved, and that is what we are planning as well. The total investment that Banyan has planned to invest prior to opening is about $1.1 million in that property. And that's including at least 20 offices for the purposes enunciated by Mr. Pena, as well as the equipment that will go along with that. There will be, at the inception, approximately 18 employees growing to 35 employees, and their salaries will be between $45,000 and $200,000. In terms of the impact from our perspective on the city of West Miami, you will have a safer building. It will not be empty anymore. There will not be any pressure on parking, as there will be more than sufficient parking. There are 60 parking spaces. We might be nice, but I don't anticipate those parking spaces all being used at the same time. You will have an aesthetically enhanced property. Banyan fully intends to paint the building. A new roof will be placed on the building. The shrubbery in the front will be enhanced. And in our research of the city of West Miami, we noted the communion of effort with respect to transportation, particularly for the elderly. We also noted that right in front of the 6400 building is a bus stop. What we think might be missing is a shelter. There is no there's a space for the parking, for the bus stop, but there's no place to sit or a shelter, and we would entertain discussions at the desire of the city to put something there for rainy days and perhaps patients of the clinic. The best analogy that we can draw that might be more familiar than Banyan to the city of West Miami is Leon Medical. Well, we won't be picking people up, but that's really the purpose. This portion of Banyan's business is primary care. Banyan has a history since 1970 of assisting those in South Florida with mental health and addiction services. In the strategic plan of Banyan, we will continue to do that, but the effort will be made to increase the primary care portion of our business substantially over the next decade. And if this committee is so approving of our efforts, we've made a commitment to be in this location for 20 years. And bringing to the city what we will believe is to bring top-rated medical assistance to the citizens of this city and nearby citizens in conjunction with the transportation, in conjunction with everything that Banyan can offer. We think it will be a substantial enhancement for all the reasons stated. Now, the opinion of professionals is there are some with mental health issues that also have medical problems known as co-occurring issues. And those will be addressed. But that facility is not intended to be, as in some of our other facilities, which are residential or primary for mental health or addiction services. That's not the intent here. But by way of example, somebody would come in with a heart issue. It's not unusual that someone with co-occurring issues might be depressed, might also have medical concerns, primary medical concerns, and we will address that in terms of looking at the whole body, looking at the mind and the body, and addressing those needs, as opposed to ushering patients off to see somebody else 7-10 days later at another location. That's what the intent there is, but I want the board to be fully recognizing that the intent here is a primary care facility, and that's what the Federal Qualified Health Center authorization is for. So that's what the intent is. We believe it will be a substantial enhancement to the building, to the area. It will afford safety and protection as Banyan will operate between the hours of 9 and 5. So there won't be any after hours activity. So I'll certainly entertain any questions.
Thank you, Mr. Morgan. I did have a couple of questions.
You want to hear from any other witness that you might have?
From the public
Yes.
hearing? We can go ahead and open the public hearing now? Is that what you're referring to?
I'm referring to that, yes.
Okay. I would prefer we can discuss things first, and then
Go
we'll
ahead.
open the public hearing. How's that?
Okay. Up to you.
Or, you're the attorney. I'm going to go ahead and open up the public hearing. It is 7 minutes till 8 p.m. I believe you have to register if you want to speak?
No, go right ahead, step up.
Okay.
We'll note it from
The reason that I said that is that I was just approached right before the meeting started by a citizen, and I was asked whether or not she could participate.
Certainly,
reason that I said that.
definitely, definitely, the public can speak and actually is encouraged to speak. But before we get to that point, we, as a board, may have
Up to
some
you.
questions, so they may be answered by the
Up to you.
public, questions they may have. I was just curious, Mr. Morgan, we appreciate painting of the buildings and new roofs, but those are wear items that have to be done irregardless of what happens on that property. But I had a question. What exactly, because I see here ethical pharmacy, what does that refer to?
The pharmacy will not be a retail pharmacy. It will be strictly for our patients.
Correct. The terminology ethical pharmacies from our zoning ordinance, that's why we listed on there. They applied as a pharmacy, but we insert the ethical because that's what our zoning ordinance states as of today.
Okay,
It's still a pharmacy, it's just that they're not going to be selling out like CVS to the public. They only do it for their dispensing of their patients that are there.
and basically all kinds of drugs, right? Narcotics.
Whatever it's allowed under
Whatever,
their license.
no marijuana dispensary, none of that?
That question goes to Mr. Morgan.
Okay, no.
That is
I'm
not part of the
sorry, I
pharmacy.
should have mentioned that.
¿Cómo se llama?
Please forgive me. You mentioned the parking, there's 55?
60, I
60
believe.
60 spaces.
But you anticipate 18 to 35 employees eventually. Are they going to be commuting to the job, or?
There will, the history of Bangor is there are people, I don't have, because we don't have all of those spaces by name yet, as you can imagine. Historically, people do travel to work by use of public transportation. But with the 60 spaces, and as we open up with 18, even assuming everybody were to drive to work, there would be ample parking that would afford 42 spaces, if my math is correct, for patients. And it's highly unlikely that we would ever have 42 patients at the same time.
Do your patients normally drive themselves for care?
No, but what I'm trying to suggest is,
No,
assuming the
out of
worst-case
curiosity,
scenario.
Sorry, out of curiosity, normally in your clinics, do the patients drive themselves there
Some,
voluntarily?
there are those that do, and there's a substantial number that do not, and they are designated by court order or otherwise.
Thank you, sir.
Saturdays, are you open on Saturdays, Mr. Morgan?
I don't believe that's in our initial schedule.
Okay.
I did not understand when they said designated by court order.
There are individuals who are in our other facilities that are in the criminal system that have been sent to what was at one point the drug court, and they are ordered for rehabilitative services, either mental health, addiction services, or something of that nature.
And they're transferred to you by the court
That's correct.
facility?
That's correct.
There will be an escorted patient that will come out from the court as a court order, right?
That's correct.
Right.
I beg your pardon? Oh, but let me be clear, none that, in case you misunderstood, that none of those scenarios would impact the property at issue here in West Miami. A number of those facilities are residential in nature. Bangor has had a long-time contract with the Federal Bureau of Prisons on the other part of the county, and those individuals are sort of moving away from the prisons in sort of an environment of a halfway house. None of that reflects the primary care services that will be rendered here at 6400 Southwest 8th Street.
But if I may ask, a number of your patients, a certain percentage, probably a high percentage, would be some of those patients that were previously at your other facilities, maybe involuntarily, they got out, they're under court order, and they're going to come to your facilities to seek other medical services.
I've not looked at that data. I don't think there's any historical or empirical data to support that.
Okay,
Unfortunately, and I say this as an unfortunate note, but a large number of individuals who have gone through tough times and have spent time in those services are not focused on their primary care, honestly. They're not going to the doctor twice a year to get a physical. Perhaps they should, but that's the commentary of life amongst those who have those difficulties.
What do you normally do in your facilities, or you're proposing to do in this particular facility for security purposes? And have you consulted with our police chief? Has the police department opined on this, Mr. Pena?
Not as of yet.
No, we have not. Historically, Bangor has not. We've always maintained good relationships with the police in the area surrounding our facilities, but it has not been the practice to speak to them beforehand.
And security, on-site security for your facility? What do you propose?
Well, given that this is a primary care facility, it was not anticipated that we would have security.
Even though you have a mental
Well-
exam rooms and
Let me be clear, because it seems like that's distressing, folks. And I would like, this is sort of an enlightened view of the trouble of the American view of people with mental illness. We now know by virtue of disclosures that mental illness is pervasive, whether in our own families, but certainly throughout society. And a number of folks with mental illness also have primary care issues. Our facilities are keen to see that, as opposed to going to a doctor who may focus on a particular primary care issue and says, I think patient A also is depressed. So we're going to make a referral to Dr. Y 3 weeks down the line, and hopefully he goes. Because what we see is depressed patients are not running out the door to go to see another doctor. They may deal with the primary care issue, but they sort of put off the depression. If our doctors handling primary care see somebody with indicia of mental illness, we can walk that person down the hallway to be looked at by somebody and dealt with in the myriad ways that those doctors can do it. And we think it's an enlightened way to practice medicine and take care of our citizenry.
it seems to me like it's like you have everything available in your facility. You have regular general care or primary care. I would assume most doctors, if a patient does have mental, or they detect or they perceive the individual, their patient has some mental illnesses, they can always be referred to a specialist. The primary physician can do that. But it seems to me kind of odd that you can get your teeth done and also get any mental illness issues addressed and your general health as well. It's like
If-
one shop does it
Well,
all.
if I may, under the federally qualified health center, this is very consistent with the first Bush administration established federally qualified health centers some 30 years ago to serve exactly what you just said, to be a place for individuals who don't have necessarily the wherewithal, don't have the various doctors to come and be taken care of. And that's what the import of that program was by an administration years ago, and it continues to be funded. So the nature of a federally qualified health center is exactly that.
Okay, and just out of curiosity, are your patients mostly indigent and their services are being compensated or paid by the federal government or some other government programs?
By the federal government, by private insurance, to some degree from their own pocket, so it's really a wide breadth of payment services.
But mostly or majority, is it private insurance or federal government type program monies?
I don't have the numbers, but it certainly crosses the whole boundaries. I mean, there are grants for indigent folks who can't pay for it, and then Banyan deals with private insurers, any number of them. We have contracts with Baptist and Jackson as well.
Okay.
I got a concern. Some of these mental issues and rehabs can not only be treated by medicine or drugs. I don't see a component here where you have counselors, group counseling, rehabs, any type of mental attitude, so you can provide mental support via counselors or whichever way you can, maybe group interaction. I don't see that expressed here, and that's a concern I have.
Well, that is part of Banyan's business, and we have done that since 1970. That's not the import of this facility, though. That's not the focus of this facility.
Yeah, but it seems to me that you're planning everything in dispensing medicine without treating the actual problem of addiction or maybe a rehab. I don't know, maybe I'm not reading this properly, but not all the problems can be treated with medicine. And I've been a counselor for 45 years, and medicine can only take a part of the situation. But if you don't adjust the mental attitude and the habits of the person, you go back to square one to prescribe more medicine. That's my point.
Well, I can't agree with you more. All we're saying is that facility is intended to be primary health. We are not going to turn our backs on if there is a diagnosis of these other issues. And those people can go to any one of our other facilities for those exact purposes. For the very reason that it's 7,500 square feet, we logically can't do everything there. And the import of this facility was to be primary health. That's where the strategic plan of the entire company is focused upon in the future, primary health. We believe that's a designation that the federal government has afforded Banyan, and that is the focus of this facility. And I would ask that it's sort of like no good deed should go unpunished. We shouldn't be punished for being keen to having a keen eye to depression and mental health. But we won't go through the counseling and the other modalities that are available to help people at that facility. That's simply just not what will happen there. It's not that it won't happen, it just won't happen there.
I have a more technical question, two questions actually. One is very technical, which you may or may not be able to answer, is why are these walls separating the mental health rooms all fire rated as opposed to regular 4-inch interior partitions?
Could that be the vault? Is that where the vault was?
No, these fire ratings are new walls.
They are?
I candidly don't have an answer, but I will find out for you.
Okay. The next question is also technical and is more related to zoning, and maybe Mr. Peña can explain it to me a little bit better. So on the staff report, it says, medical offices or facilities are not an allowed use as other normally permitted use because of the potential and adverse effects to the community as a whole. Okay, so
That's what the
is
code says.
That's what the code says, that's why it's a special use, that's
It's
why
a
it comes here.
special use, but what would be permitted as of right at that location?
Banking facility,
Banking, office,
offices, general
non-medical.
offices, non-medical.
Okay. So they're coming to this board to get the use, the conditional use, to use this as for this function.
That's correct. The purpose of the special use permit is to always see the intent of the applicant, the effects, the size of the building and the appropriateness of the building, and then how it fits in within the community. And then you are to base that on your decision.
And to add to that, it's not a mandatory thing. I mean, you're not obliged to approve something that is not in the code. Because the list, there is an exhaustive list of what is permitted, and medical treatment is not one of the issues that, or occupation that is permitted. So that's why I come to you. Especially in this particular issue, there's dental services, there's medical examination, there's psychiatries, there's 5 mental health examination rooms.
Right, so every single aspect of this use is not permitted
No,
as of right on this location. Okay.
correct.
Hence why they're here before the board. Right, Mr. Villalobos?
Yes.
And the final approval will be done by the city commission, correct?
Correct.
That is correct. What I would like to do, if there's any members or anybody from the public that wishes to speak on this item, if that would be, if we can do that then, since it's already been open. Thank you, Mr. Morgan. If you want to stand by to answer any potential or possible questions that may be addressed to you and the board.
Hello, good evening. My name is Natalie Milian, and I am a resident. We reside at 6170 Southwest 19th Street. In full disclosure, I am a board member of the Code Enforcement Board for the city, and I want to thank you guys for the work you do because I know that it's hard. So I'm here today to speak in opposition of item number 1. First of all, I wanted to ask, and I appreciate all the questions you did ask because they did answer a lot of the questions that we had. If this site will be a receiving site for patients from other outside communities and other centers like Jackson or other clinics, and what will it be primarily servicing these folks that if they are bringing folks from other places? And I don't know if you want me to pause for the question or just
No, just state them all.
state them all.
You
Okay.
can stay, I'm sure he's taking notes.
Okay. I also wanted to know what are the hours of operation? If this is going to be a 24-hour site, or what are the hours that it will be servicing patients?
No,
was
ma'am,
stated
that's
9
already
to
been
5.
stated.
9 to 5?
Yes.
Okay, thank you. And how much of the services are going to be focused on mental health and addiction services specifically? I also want to know if the application itself states that the fact that this center will not service court-ordered patients, if that's in the application that you have before you today. And while I'm sure that Banyan does good work, I am opposed to this sort of center being placed in our community. We bought our first home here because we wanted a safe place to start a family. And I know that we share the same desire to make sure that West Miami remains a safe haven for everyone. So I'm asking you to consider today the impacts that this could have long-term on our community. And I am not satisfied with the information that they provided. So I ask that if you're not satisfied with that information that you have and you're not prepared to vote, that you consider deferring this item today or denying it. Thank you.
Okay, thank you. I believe most of those questions are best addressed by the applicant's counsel, Mr. Morgan.
Mr. Morgan again. As mentioned, the hours of operation will be 9 to 5. There will not be any services to court-ordered, bless you, court-ordered individuals. It's not going to be a receiving facility for people in other communities. It is going to be a local primary care facility. And that's what the intent is to be. Consistent with the mandate of a federally qualified health center. That's what it is. We will not be a reception area for addiction services. There will not be addiction services. If there is somebody that comes in as a patient and that is what is viewed as a problem, their referral will be that they have to go to one of our other places or look elsewhere. But that's not the focus. That's not what we're going to be doing at this facility.
I believe one of the questions was related to the percentage of patients that are have mental illness. I'm trying to be diplomatic.
Sure.
Will it be safe to use you're proposing 9 medical exam rooms, 5 dental, and 5 mental health, and 1 psychiatric? So would those numbers speak for themselves,
Well,
percentage-wise?
Well, these are proposed offices as we're laying them out, but I'm going to try to be as clear as I can. There's no preconceived notion that we are putting up a neon sign that you have problems with addiction, that you have mental health, come on down. This is to be a community primary health center. It just so happens that this is a company that has engaged in nonprofit services in this city for 50 years that recognizes people with those problems. So if an individual goes into our anticipated facility with a primary care issue and a professional diagnosis beyond that there is co-occurring concerns, and mind you, that's going to happen hopefully in any other primary care facility. It's not unique to what Banyan does. It's a good practice of medicine. So if that person comes in and they have high blood pressure or low blood pressure and other indicia of problems from a standard medical primary care issue, but there's other, and I'm not certainly capable to opine on that, but they have other indicators of addiction or mental illness, the professionals will see that and refer them to others there to find out how we can treat that and where they can go within the network at Banyan. That's the plan, not to provide the services at this location. But candidly, we don't want to throw them out the door and say, okay, well, we put a Band-Aid on your stitches, and if you have other problems, go elsewhere. That's not what is intended. I don't want the focus to be that this is somehow an addiction services or a mental health facility. Those are clearly ancillary. That's a practice of good medicine, given what the last 10 years in this country has indicated between suicides, between the opioid crisis and otherwise, how a medical facility can close its eyes to those concerns would be troubling. We have to recognize, or you just don't talk about it. You say, okay, well, we dealt with the primary care. We see there's depression, so do what society's done for 100 years and say, shh, go away. That's not what Banyan is about.
I understand, Mr. Morgan, and you guys do wonderful community service and maybe even the Lord's work to a certain extent, but I don't see your business doing a community service to the West Miami community. Driving over here today, there was like at least like 8, 10 folks, my neighbors, our neighbors here, walking, young families with babies, pushing baby buggies, strollers, exercising. I've been here now 25 years, and I feel like now I'm the old man. I see the new folks coming in, young families. and you do wonderful community service, but I do not feel comfortable we don't need that type of service, I don't believe, here in our community. I think our residents have other ways they can obtain medical services, be it mental addiction, counseling, whatever the case may be. They have a way to do it, and I just don't feel, I don't know, the other board members feel, I don't feel like we have sufficient information regarding like security, and the police chief hasn't been consulted. I don't think this is a good fit for our community, and I'll leave it at that. If any other members have anything else they may
I
want
have
to
to
add.
agree with 100% with what Mr. Paz said. While I understand completely that mental health is a problem in our schools, in our workplaces, in our everyday life. We encounter people with depression, with anxiety, all kinds of mental issues, and they all deserve a second chance. They all deserve a clinic, they all deserve counseling, they all deserve medication if they need medication. However, I agree that this is not for the best interest of the city of West Miami.
I second your opinion that, especially with the security factor of it, every healthcare hospital, unit, clinic, whatever you want to call it, they have an intake section where they know and they actually get IDs for everybody that comes in. I don't see a component on that unless you guys modify the safety, security, you deal with the police department, and you guarantee us that there's going to be at least a safety factor involved in there. I cannot agree with this.
Okay, I understand.
Okay.
Thank you, Mr. Chair.
Anybody want to make a motion?
Before you make a motion, could you ask if there's anybody else in
I'm
the
sorry.
public?
Yes, I'm sorry. Anybody? I apologize. Any other members, please speak. Name and address for the record. Take your time. We're not in a rush.
My name is Lourdes Wolf.
Ms.
Could you
Wolf,
bring
could you
out
lower
the-
the microphone? There you go.
My name is Lourdes Wolf, and I live at 6397 Southwest 9th Street. And if you think you are old for living here 20 years, I have been here 50. I came to West Miami in 1967, and I live just across that address, the corner of 64 and 9th. So it's very nice to say that it's a primary care, but as soon as you open the door and you said that you can leave people come in that are have problems, you don't know what problems they are going to be. And when I moved here, it was a very nice place. People respect each other. They took care of your neighbor. Nowadays, it's even different, and you can see it everywhere, in school, everywhere. You can see people, and they say, oh, because they had this mental problem. They didn't see it, they didn't take care of it, and now this happened. Well, that's going to happen there because they are going to come to that door. And I just live across the street, and my friend lives on 9th Street, across the street from that same property. It isn't nice to have that in this neighborhood. So I ask you to please consider, I heard whatever you said, but if they say that they can take care of mental problems, there are going to be mental problems there. Whether they, whether they choose to put whatever he said about
Security?
security, is going to be a problem anywhere. So
Okay.
please consider that. Just think about living across the street from that and having to live 24 hours there.
Thank you, ma'am.
Thank you very much.
Does anybody else from the public wish to speak? Okay, being that no other members from the public have chosen to speak, I'm going to go ahead and close the public hearing. It is 8:25 PM. Does anybody from the board have any additional?
Very simple. I'd like to
Question.
make a motion to deny the request for special use permit for the property located at 6400 Southwest 8th Street.
I second that motion.
Okay, on the motion, Alvaro Lurido?
Oh, wait.
Oop.
Yep. I have a question for Mr. Villalobos. Can an application be denied with prejudice?
No.
No, okay. That's it. I sustain my motion.
Okay, there was a motion and a second. On the motion, Alvaro Lurido,
Yes?
Diana Rio,
Yes.
and I vote yes too. Thank you. Yes.
Give us a second, please.
I knew it. When I had that thing, I knew it. I knew it.
Next item on your agenda tonight is item number 2, public hearing agenda. Public hearing agenda. Property address is 14, known as 14XX Southwest 66th Avenue. Elite Homes 14XX LLC. Applicant requests a special use permit for planned development of two 53-foot lot previously submitted for a tentative plat for the property at 14XX 66th Avenue. The property is zoned R2 duplex, and the applicant is requesting to build two two-story duplexes divided by a party wall on each parcel. The developer will construct two new two-family homes. The area is zoned R2 duplex, special use index 2019-004, zoning ordinance 282, section 2B.
Thank you, Mr. Pena.
Good evening. Oops. Carlos Gancedo, the owner of the Elite Homes 14XX, 2223 Southwest 68 Court, Miami. Any questions? And the idea is to build two new duplexes, 2-story high. We are eager to start. We've been here a couple times already, so any questions, be happy to answer.
Okay, quick question, Mr. Pena, this is the property that had the issues we heard recently regarding easements and lot splitting?
No?
This that case, right? Or that property?
There's no easements required. I mean, there's a dedication of the roadway required, which is part of the tentative plat.
But
And
this
that-
is the case of that tentative plat case that was before us previously.
That was approved by you.
Right, 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 right. I had a question, because I believe at that time, I believe Ms. Rio was the one that mentioned about deleting, if word could get out to the architect, to delete the door, the entry doors, because it seems like you have two doors right off the parking lot, the parking spot, space. And we had some concerns that that could easily be modified into efficiency or something like that. Do you follow me? The front entry, you got a single door off to the side of the unit, and then there's also a double door there as well.
The
And,
double door seems to be the entrance to the unit, and then there's a single door leading into a small room with a closet, a bathroom, and a
right,
sink. And that door leads to the exterior. Those doors need to be deleted, be removed, and no other exterior doors other than the entrance door. So in other words, not to create a separate living unit on this by removing that,
correct.
those four doors.
Make a window,
Right.
fix glass.
It's not intent to use that as a separate living unit at all.
Your intents are not, but the person you sell it to may see that as a possible way to maybe recover some of the costs associated with the purchase. 'Cause other than that, they're beautiful. I personally think they're really lovely.
Thank you.
And I'm all for them. That is the only issue really that I have as a board member, is that, and it's also shared by another one. I'm not sure what Mr. Laredo's opinion is, but you can certainly mention it. But that was something we had some concerns in, as we heard the previous land use issues related to this case. So,
I have a
you have another issue?
question.
Okay.
No, just a question. As far as parking, so there's 4 units here and only 4 parking spaces? Each of these units are 3-bedroom units? And is that, or 4-bedroom units if you count the small room at the bottom? So for a 4-bedroom duplex, do you only require 1 parking spot?
No, the actual requirement for the duplex is 2 units per, 2 spaces per unit.
2 spaces.
Regardless of the number of bedrooms?
That's correct.
Okay. So,
Two.
shouldn't there be 8 parking spaces?
2 per building or 2 per individual units?
2 per unit.
One building is 1 unit?
No,
No.
It-
each building, each
Okay.
unit is individual by the separation of the party wall.
So where are the other 4 parking spots?
Well, from the last submission, the site plan was changed because it had the front united. I guess it was maybe decorative to add
Yeah, it's
in.
probably decorative. We had to go with definitely 2 parking on
Yeah.
each unit.
So previous model showed 2 and 2 in front of each unit. You could just state that in your decision, and also they'll have to resubmit the site plan indicating the parking space.
Well, I don't feel comfortable with that because that means that each of these parking spaces are gonna be tandem. And the 25-foot front setback, one of these parking spaces is within that front setback, which is fine, and then the other one is going to be behind that.
No, it will be
No,
next
no,
to it,
next to
adjacent
it.
to
Yeah,
it.
next.
Where next to it, I see another parking spot. Tandem is one behind the other.
I understand that. Adjacent is right next to the other one. You're not looking at the party wall. Each unit has a party wall.
So that's the party wall there?
Yeah?
So this is
So
one
the-
spot, but this is gonna be parking there.
Exactly. It
Because
will be
they'll
2
have to fit a parking
one
spot
next to
here.
each other. No one
So
behind.
these stripes are parking,
Exactly.
Well, they were parking. I don't know if the architect must have changed it when he revised the site plan to show the landscape and everything else and made it look nicer, but unfortunately, he needs to put the parking.
Yeah.
Okay, I got it now, okay. And some plans show a pool in the back, and some show an existing Ficus Street main.
We're still working on the back design and the actual pool. The pool is not a decision yet. Most likely it won't happen.
Yeah, the pool's up to whoever buys the unit or what the outcome is. It's just showing that it has the possibility of a pool.
Exactly.
And aside from the ficus tree, you have some really nice trees there. Mango, lychee, níspero, some good fruit trees there. Mr. Penna, if we were to approve the projects with those conditions, will he have to resubmit, or can he just, from that point on,
It goes
go with-
forward to the city commission.
There's no point in,
No.
having, for a little minor revision.
Exactly.
They will be changed for the commission, but, we can approve them subject to having those changes.
Because it would be part of the.
Yes. And you can make a motion.
part of the
and
report we
specifically
submit to the
state
city
that in
commission.
the motion.
But just for the record, the doorway to
Bedroom?
to that bedroom, you previously approved it on other townhomes that have gone through here.
And I personally asked that question several times, whether that was an issue, and the response was always, no, we're gonna.
It hasn't been an issue.
No, I asked if we could comment on that at that point, when they were doing the lot split or whatever they needed to do for this.
Oh.
I personally asked about those.
Oh.
and-
Right.
and the
I think
response
Mr.
was
I-
that they're coming back, and then at that point, then that's when you.
Correct, on this
I
one.
think
on
Mr.
this
Penna
one.
refers to that we.
The other units that we've approved in the past.
In the past, we've approved units similar to
Because
this,
it's,
and
the,
and we
the,
didn't
the
notice.
the concept of that room is when, now that the in-laws are living with you, they don't have to go through your front door, they go straight into their room, they come out straight from their room. But that's the concept, that's why the house has the connection interior and it has to remain that way. Anytime we process one of these, there is, inspections that are done at our, request.
Uh-huh.
And there's nothing to prohibit someone, like you said, from turning it into a rental unit, but we will be vigilant of all those units.
It may have been an oversight on my part, personally, not noticing that on other townhomes or townhouses that have come and been approved before us, but the old adage, two wrongs don't make a right. I don't agree with that concept, having that and in-laws, and I do not feel comfortable with just a separate door into a bedroom and the main entry in the foyer.
That's fine, it's up to you.
I'd like to make a motion to approve the project, removing the 4 exterior doors that create an exterior entrance or exit from the in-laws'
Bedroom.
quarters, and for the plans to reflect the 2 required parking spaces per unit, not the striping. If they want to use that as parking, so be it, but label it clearly as a parking space.
Okay, I'll second the motion. On the motion, Alberto Narito,
Yes.
Diana Rio,
Yes.
and I vote yes.
All right, thank you.
I'm sorry, this was a public hearing as well?
Yes.
Okay,
You could open it still.
okay, we're gonna go ahead and open the public hearing now, on this matter. If anybody from the public wishes to speak, let the record reflect that nobody from the public approached. Apologies for that.
Make your motion again, please. Just for
Ms.
the record.
Rio?
I'd like to make a motion to approve the project, but with the conditions of removing the 4 exterior doors that create the entrance to the in-laws' quarters, and also clearly labeling the 2 required parking spaces per unit.
Let me suggest that the chair does not second the motion.
Okay. Can we, before we second it, because Ms. Rio used the term in-law quarters, what I would like to instead, if she may incorporate, not naming it something, just calling it the habitable bedroom, so they don't change, oh, it's in-law, that wasn't allowed, but
That's
a
fine.
den would be with a separate door.
It would be the,
I-
Architectural, like,
downstairs
way
bedroom.
loophole.
the
if you will.
downstairs bedroom.
Yes, I amend my motion to approve the project with the condition that they remove the exterior door leading to the bedroom or to the space, to the living space on the ground floor towards the front of each unit, and also clearly labeling the 2 parking spaces per unit.
Just to add, in case it's required by fire code, it could be changed into a window if the fire
Yes.
code requires it.
Yes,
Which, being a bedroom, it would require a casement window of some type would meet that.
Do you need a motion to amend that, for that amendment?
We need a second again?
You need to,
Well, she did, I need to second it.
Okay, it was a motion by Ms. Rio, seconded by Alvaro Lurido. On the motion, Alvaro Lurido, Ms. Rio,
yes.
and I vote yes.
Good night.
good night.
All right, thank you.
Okay, the City of West Miami Planning and Zoning Board meeting of October 22nd, 2019 is now adjourned. It is 8:40 PM.
It's up to you.